Member for West Vancouver Capilano.
Mr. Speaker, the murder of Burnaby RCMP Constable Shaylin Yang was a call for action to deal with the massive gaps and missed opportunities in mental health and addiction in this province. 19 months ago, Burnaby RCMP begged this government to establish a mental health CAR program, an integrated crisis response pairing police officers with trained mental health nurses. But the Lepard report revealed a shocking fact. The NDP declined the City of Burnaby's funding requests for a mental health police car model. Quote, Fraser Health declined a proposal from Burnaby RCMP even though the RCMP were prepared to allocate a full-time officer, a vehicle, and other equipment, end quote. To the Minister of Mental Health and Addictions, why did this NDP government decline the funding request to establish a safe and proven mental health police car program?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The tragic death of the RCMP constable in Burnaby on the front line doing some of the most difficult work that we ask our frontline people, public servants across the province to do is heartbreaking. It weighs heavily on all of us. We send our condolences, of course, to her family and friends. The intersection of mental health, substance use, and public safety is, of course, something that's preoccupying everybody on both sides of the House. That we have in multiple programs pairing of enforcement and of healthcare is a really important evolution and one that we're expressing through our programs in many ways. Also, again, important to assert that for the most part, people with untreated mental health and addictions are not themselves violent. And we don't want to contribute to stigma that prevents people from stepping up and asking for healthcare support. But there are times that those pieces come together, and that's why we commissioned the Lepard-Butler report. It's why we commissioned the Police Act review. It's why in a number of ways, in some cases through car programs where there is a ride-along service, in other cases with peer-assisted crisis supports like we are funding on the North Shore, so that people in crisis are not escalated by the presence of police officer. There is more work for us to do in this area, but we are gathering data and evidence on a number of platforms led by a number of municipalities and a number of health authorities that are tackling this problem together in different ways.
Member for West Vancouver Capilano, supplemental.
Mr. Speaker, thank you. I'm not sure that the minister completely understood the question, so I am going to rephrase this. It is not enough and it is not fast enough, whatever is happening now. Pairing mental health support workers with police, like the CAR 67 program in Surrey, is a proven approach. It's happening in communities, community-based and community-funded, and we can show that it works. Over the past 5 years, this opposition has called for these programs to be expanded, Mr. Speaker. 7 months ago, the All-Party Police Committee called for them to be expanded as well. And now government's own Lepard report calls it a proven approach blocked by the NDP. How many reports does this government need before they act? And I quote from the Lepard report again. They declined a proposal from Burnaby RCMP, and Fraser Health provided no explanation, end quote. So this NDP government has ignored every suggestion that we have made related to the crisis on our streets without explanation. So why has the NDP blocked integrated mental health teams?
Minister.
Thank you, Mr. Speaker. I don't agree at all with the member's characterization, and I'll go through a number of the programs where we are exactly tackling these problems with integrated police and mental health teams. And there is more to come and more to do. Vancouver Coastal Health has 3 CAR programs that are funded through the Health Authority: Vancouver, North Shore, Richmond. Fraser Health has CAR 67 in Surrey. Interior Health has Kamloops and Kelowna. Northern Health has Prince George, Fort St. John, Terrace, Island Health House, an integrated mobile response team in Capital Region. In many of the programs where the previous government started them and we have continued to expand them, ACT teams, there's a police liaison, so the crisis on the front lines, in the streets, often with people who are unhoused, has a direct link to police. And this is what we heard through the Police Act review and through Lepard Butler that are working well and we need to expand. And most encouragingly, and one that we have a lot of police support for, is instead of asking police to respond to mental health and crisis on the street calls, that like on North Shore with the peer assisted crisis team, it's the peer worker team and the mental health worker team that respond, and if they need police backup, then they are called in. And we've got data on this from the first year. We're funding this in 2 more communities, and I hope we'll fund it in more.